Rachel, thank you so much for taking the time with me today. I'm excited to hear what you're working on with Upside Health. Let me start big picture.
Yeah.
We're at an event with hundreds and hundreds of health innovators, and you're working to upgrade how chronic pain gets managed. And so I wanted you to start by talking to us about the pain management market and kind of where people are innovating and where we stand.
Yeah, I mean, the chronic pain market has been exploding. The pain market has been exploding, but the chronic pain market as well. And it's been tackled in a bunch of different ways. Some have been through assessments. Some have been through care management platforms. A lot has been in the direct to consumer or direct to payer expansion of care. And a lot is around MSK, musculoskeletal pain, which is a humongous driver of cost.
Why do you think there's been an explosion recently?
I think that the market's been tested a little bit. And when the market has been tested, you feel more comfortable, but also as you see the population is aging, and pain is a component of aging, particularly MSK pain. And so I think health systems, hospitals, payers are all feeling this enormous burden where they thought they were able to tackle it with these bundled payments around hip, knee, spine. It's not working, or it's not working well enough. And so how do they continue to guarantee these outcomes, and what are the products they can use? Also, I mean, pain, because it is so personal, works really well in a digital form, because by getting a lot of data, more data than sometimes you can get longitudinally in a doctor's office, you can actually provide that really precise care.
When you say pain works well in digital form, walk me through the patient experience. Let's use Upside Health as the example. So managing pain, chronic pain, using a platform, what does that mean?
And to clarify, pain does not work well in digital form, but pain care does work well in a digital form.
Longitudinally.
Exactly. So our product is called Branch, because it is a branch of chronic pain care. And what we do is we take patient-reported, so patient's experience on pain and function, mood, sleep, and then we pair it with passively collected insights. So has the patient been stagnant or active using GPS coordinates?
Okay, they're wearing a wearable, a phone, how does that work?
So GPS coordinates is purely from your phone.
Cool.
We can also work with wearables, including Fitbit, Apple, Google, to determine step count. And then we also have devices that pair exclusively with our product to recognize heart rate variance and medication. We take all of this information together and provide a variety of pain scores that more accurately affect the patient's experience with pain.
Okay.
And then we deliver to them the parts of care that I mentioned. So mindfulness, sleep hygiene, movement, art therapy, pain education, peer support, all of those things that they're not going to be able to offer in scale in a traditional care setting.
Obviously, one of the big outcomes of this is reducing pain for patients. You're meeting them where they're at, you're giving them the therapy they need. Talk to me about the benefits for the provider and for the hospital of being able to address these issues.
Yeah, I mean, I think there are a multitude of opportunities for health systems and healthcare providers. One is truly and I hate to use the word burden, but the drain that this system utilization of this population, causes for systems. They they use systems like 3 times more than any other disease state. They see an average of 12 physicians a year, and most of those patients require multiple touch points. And so one is really being able to support these patients in a new way, and a way that keeps them out of the office or the appointment unless necessary. And secondarily, and hopefully, we're going to be looking at really the decrease in ER visits, the decrease in overall system utilization, so these patients can get the best care for them, and the clinicians can focus on the areas where they are most trained and most efficient. I think the other just quick note about that too is really in regards to opioid usage. I know that it's a huge area of concern. Obviously, we're behind the moonshot in that space, and we've been able to see, reduction in opioid usage amongst our patients, and it's not.
How much?
30% of our users were able to decrease or stop opioid usage, and I think a lot of that is just because these patients have the support, right? There's somebody holding their hand through this pain journey. and helping them both reassess their relationship with pain, but also allow them to see how efficacious other treatments can be if you stick with them.
I think this point needs to be, emphasized again and again, that there are these non-opioid treatments for pain that can seem simple to people, whether it's tracking and journaling, understanding your pain. And you mentioned, whether it's cognitive behavioral therapy or whether it's art therapy, all
peer
these
support. There's like peer support, right? Like
seemingly simple interventions. That you said 30% reduction in opioids.
Yeah.
It's massive.
Well, and most of these patients too are in some sort of opioid tapering program, right? So there is that initial push, the initial step either they or their clinician has taken, but how do you get from here to there in a way that is not burdensome or disruptive?
Yeah. Who do you generally work with? Who are your clients?
So we have been working with physician groups, large physician groups, pain practices or other specialty practices, and then health systems, particularly regional medical centers, community hospitals that have large catchment areas, but few pain specialists.
Okay, and sort of what is the sort of next big move for Branch this year?
Yeah, I mean, my big priority, obviously continuing to grow in sales. I think we've reached more than 20,000 patients, and that number is continuing to grow. But really finding the right strategic partners who have these networks in place, who are hoping to be able to create change within this population, but they don't have the resources or the specialty to do so. And so whether that's another digital health company, whether it's a payer or whether it's a system, we want to help support you with that.
Awesome. Rachel, thank you so much for taking the time with me. Thanks for tackling this issue. I know a lot of people have suffered in silence for a long time with chronic pain. I'm glad that you're seeing a trend towards innovation in this area, and that you guys are working so hard at it at Upside Health. So thank you.
And thank you for being a partner with us in this.
Thank you.